Good day everyone, I am Lady Elaine Poquiz, a student nurse at Isabela State University from BSN 1-3. And in this video, I will be performing my return demonstration on the assessment of the head and neck. Prior to the conduct of the assessment, I already performed proper hand hygiene, and as you can see, I already put my gloves on. Also, I have gathered the materials and equipments needed, and here they are. I have a pen light, a glass of water, a stethoscope, and a pair of gloves. Okay, let's begin. Good day, ma'am. I am Lady Elaine Poquiz, your student nurse for today. Would you please confirm me your name, age, and birthday?
I'm Roxanne B. Castillo, 18 years old, and July 14, 2000.
Okay. How would you like me to call you, ma'am?
My name.
Okay, Miss Roxanne. We are here today to assess your head and neck. This is done to ensure that everything is normal, and also to determine if there are any abnormalities or any potential risks so that we could prevent them from further complications. Do you have any questions before we proceed?
Nothing.
Okay, ma'am. Miss Roxanne, there are certain part of the assessment wherein I will touch some parts of your body. Oh, would you allow me to do that?
Okay.
Thank you, ma'am. I assure you that all of the gathered information later on will remain confidential between you and me and to the attending physician that I will be referring you to if necessary. Okay, ma'am? Also, I already closed the doors and windows to provide privacy for you as my client. Okay, let's now begin with the assessment proper. The first step is to inspect for the head for size, shape, and configuration. Okay. Okay, as what I have inspected, I can see that you are a normocephalic, or meaning that your head is in the normal size and shape. I also observed that your head is symmetrical and properly proportioned to your body. Next step is I'm going to palpate the head for consistency. Allow me to touch your head, ma'am. Okay. As I'm now palpating, I cannot feel any lesions, lumps, or masses, which is a good sign. Okay. And there is also no presence of parasites, which is also a good sign. Okay, next step is I'm going to inspect the facial symmetry, features, expression, movements, and skin condition. Okay, look at me, ma'am. Would you please smile for me? Wide smile. Okay, raise your eyebrows, please. Both of them. Down. Raise again. Down. Okay. Would you please close your eyes tightly? You can open it. Okay, upon inspection, I observed that the face is symmetrical and there is no abnormalities with the facial features and expression such as unnecessary movements. There's none of them. Next step is I'm going to palpate the temporal artery for elasticity and tenderness. Allow me to touch your face, ma'am. Clench your teeth. Did you feel any pain upon palpation, ma'am?
Nothing.
Nothing. Okay. After palpating the temporal artery, I have observed that it is elastic and non-tender. Next, I'm going to palpate the temporomandibular joint. Okay. Open your mouth, ma'am. Close. Open again. Close. Open. And close. Thank you. Okay. After palpating the temporomandibular joint, I have observed that there is no presence of swelling, no tenderness, and crepitation upon movement. which is actually a good sign. Okay, now we are done with the assessment of the head and face. We can now proceed to the assessment of the neck. In the assessment of the neck, the first step is to inspect the neck first. Okay, allow me to look at your neck now. Okay, I have observed that the neck of my client is symmetrical and centered. I also observed that there is no presence of masses or lumps, which is a good sign. The second step is to inspect the movement of the thyroid and cricoid cartilages. Okay, please take a sip of water and allow me to take a look at your thyroid while you drink the water. Okay, you ready, ma'am? Go. Okay, another sip. Okay, thank you. As you swallow, I have observed that the thyroid and cricoid cartilages moved upwards symmetrically, which is a good sign. And also, there is no presence of swelling or inflammation. Okay, next I am going to inspect the cervical vertebra of my client. Would you please flex your head, ma'am, and look downward? Okay. Okay, ma'am. The cervical vertebra of my client is visible and prominent, which is the normal finding for cervical vertebra, meaning there is no abnormalities. And the next step is to inspect the neck for the range of motion. Okay, ma'am. Turn your face on your right shoulder, on your left. Turn your chin downward on your chest, like this, upwards. Touch your ear to your shoulder on the other side as well. Okay, thank you, ma'am. Upon inspection, I can see that your neck movement is smooth and controlled. Okay. Next step is I'm going to palpate the trachea and the thyroid gland. Okay, allow me to palpate your neck now. Okay. Your trachea is centered or in the middle and symmetrical, and there are no presence of any lumps or masses, and I also observed that it is not swelling or inflamed. Okay. The next step is to auscultate the thyroid gland for bruits if the gland is enlarged. And in auscultating, the bell of the stethoscope is utilized. And take note for any abnormal sounds such as wheezes. Unfortunately for my client, since Miss Roxanne has a normal size and shape of the thyroid gland, we won't have to do this part. The last step for the assessment of the neck is to palpate the lymph nodes for size, shape, delimitation, mobility, consistency, and tenderness. Okay? I am going to palpate your facial and cervical nodes. If ever that you feel uncomfortable or if you feel any pain, just let me know, ma'am. Okay?
Okay.
Okay? Let's begin with the preauricular node. Postauricular, occipital, tonsillar, submandibular, submental, okay, to the superficial cervical node, posterior cervical node, deep cervical chain, supraclavicular node. Okay. Did you feel any pain upon the palpation, ma'am?
Nothing.
Okay. After the palpation of the lymph nodes, I have observed that there is no enlargement, no presence of lumps, masses, or lesions, and there is no swelling of the lymph nodes, which are actually a good sign. Okay, this ends our assessment. Thank you for your time and cooperation, Miss Roxanne. Have a good day.